Welcome to today's HealthLine webinar from the American Association of Kidney Patients titled Best Practices for Infection Prevention and Dialysis Care, Insights from the Centers for Disease Control and Prevention, Making Dialysis Safer for Patients Coalition. Thank you for joining us today. My name is Jerome Bailey, Director of Patient Engagement and Advocacy for AAKP. AAKP is the oldest and largest fully independent patient-led kidney patient organization in the U.S. AAKP is proud to host this webinar series as part of our mission to empower fellow kidney patients, family members and care partners, healthcare professionals, researchers, and policymakers. AAKP's HealthLine and HealthLine Innovator webinars fall under our Center for Patient Research and Education. We believe patient and care partner education is an integral part of an individual's treatment, and to that end, AAKP is a champion for full patient care choice, the protection of the patient-doctor relationship, and the elimination of artificial barriers and government determinants of health that impede patient care choice and access to available treatment options. At AAKP, we work to ensure that patients have a central role in the research and development process so that unmet needs are identified and unique patient insights and lived experiences fully inform innovation and the product development lifecycle. This includes clinical trials to regulatory action and payment decisions. Through our initiatives, we aim to ensure patients have a central voice in research and innovation. By leveraging lived experiences and unique insights from the kidney community, we help drive meaningful advancements across the entire product development lifecycle, from clinical trials and regulatory processes to payment decisions. As medical science progresses with personalized medicine, cutting-edge technologies, and novel treatments, the potential for better outcomes in kidney care has never been greater. Patient safety has always been a cornerstone of AAKP's mission. In 2024, AAKP rolled out our safety awareness and public education campaign titled Every Patient Safe. The multifaceted campaign focuses on the unique risks and unmet safety needs of vulnerable kidney patients and kidney transplant recipients. Those risks include ongoing susceptibility to serious COVID infection, premature death, increased vulnerability to healthcare-acquired infections, and catheter-related bloodstream infections among hemodialysis patients, future pandemics, and disruptions caused by sudden natural and unnatural disasters. Since 2016, AAKP has been a proud partner of the CDC's Making Dialysis Safer for Patients Coalition. This collaborative initiative brings together healthcare organizations, patient advocacy groups, industry leaders, and public health partners with a shared goal: preventing bloodstream infections in hemodialysis patients. The coalition provides evidence-based resources and tools to improve patient outcomes and strengthen infection prevention practices. We are excited to highlight the coalition's impactful work today. But before we get to our speakers, we wanted to take a few minutes to share some insights from a recent AAKP flash survey conducted through our Center for Patient Research and Education. The goal was simple: better understand how patients and care partners are experiencing dialysis safety and infection prevention in real life. To walk us through what we heard, I'd like to introduce AAKP's Vice President and Chair of Policy and Global Affairs, Paul Conway. Paul is a passionate advocate for patient-centered care, patient participation in true shared decision-making, and the use of patient insights in kidney research. As a kidney disease patient himself for 48 years and a 28-year transplant recipient, he has been recognized for his advocacy work with several national awards, including the President's Medal from the American Society of Nephrology. Paul has served in 4 U.S. presidential administrations, including as Chief of Staff for the U.S. Department of Labor. He was selected by the FDA to serve as the inaugural chair of the FDA's Patient Engagement Advisory Committee and has served on the American Board of Internal Medicine's Nephrology Specialty Board as well as multiple CMS technical panels related to dialysis quality improvement measures. Paul is here to share the results from the Flash survey. Paul, take it away.
Thank you very much, Jerome, and thanks for putting together this absolutely fantastic webinar. It's a pleasure to have the CDC back with the AAKP to talk about some of their insights on infection prevention and control. You've heard a lot about quality already. And quality in dialysis comes down to what is the best service for patients and treatment for patients in a safe environment to make certain that the treatment they're receiving doesn't put them at further risk. And along that line, we thought we'd go ahead and reach out to patients and ask them and their loved ones and care partners specific questions related to their experiences. Let's go ahead and bring up the data here because I think it shows a pretty interesting story. This was data that we gathered in our spring 2026 survey related to dialysis patient safety. We asked folks what type of experience they had with access options. And you can see here, AV fistula, about 2/3 of the folks have that, 66%, central venous catheter, about 39%, and an AV graft, 24%. These are the types of access options that people have experience with across their journey with kidney disease. Oftentimes, they'll have more than one experience with more than one access. We asked, what type of access do you or your loved one currently use for dialysis treatment? And you can see AV fistula is about 60%, and AV graft 18%, central venous catheter 11%, or other 11%. Let me just say that the AV fistula at 59%, that's a choice that many folks have made in part due to national efforts that prioritize fistula first in the past decade. We asked, have you or your loved one ever experienced any of the following healthcare-associated infections, or HAIs? You can see nearly 40% have experience with sepsis, catheter-related bloodstream infections, BSIs, 16%, MRSA, 11%, staph, 11%, and strep, very minor. We put this up here so that folks can understand the complexity and the risk that folks have and the experience that people have. And when one patient is in a dialysis center looking out for another, they're looking out for specific safety concerns because nearly every patient understands the grave consequences of infections. We asked, how confident do you feel in your or your loved one's ability to prevent infections or future infections related to dialysis treatment? Here you have about half the respondents saying that they're very confident, 43% saying somewhat confident, 7% not confident, 2% unsure. What we're zeroed in on here is those that are somewhat or not confident. That's half the population of the folks that we surveyed. And that's very important because what we want to do is make as resilient as possible those who are being treated so they have the confidence to know what to look for and ask for in their own treatment to stay safe. We asked folks if a new medical innovation were made available to you or your loved one to better protect dialysis catheter access and to help reduce the risk of life-threatening catheter-related bloodstream infection. Would you want your or their dialysis center to provide that choice? The answer was 90% yes, 10% were unsure. No one said no. The reason why we asked this is because we're living in an era of innovation, and there have been some very fantastic innovations that have emerged, especially those that deal with BSIs and that reduce infection risk to patients. When we ask patients about it, there's no doubt that regardless of where they are located geographically, what their background is, socioeconomic, everyone wants choice, especially those choices that empower them to better protect themselves. We asked, how often do you or your loved one inspect your dialysis access point, your catheter, your fistula, or your graft for signs of infection? Here you have the majority saying every day. You have about 24% saying a few times a week, and then lesser portions once a week, rarely or never. But you can see a very high awareness level of what to look for and where to look for it. We asked how often you or your loved one are reminded about the importance of infection prevention by the dialysis care team. This was interesting to us because always 50% responded, so they're constantly being reminded by their teams. Sometimes 24%, rarely 21%. We were saddened to see this. It's not a reflection of every facility, but it does show you how in a busy facility, sometimes staff are not in the position to remind patients or to reinforce those key learnings many of which we'll hear today. So we're focused very much today on the 45% that make up the sometimes or rarely reminded. We asked how comfortable you are with the care and cleaning process of your or your loved one's access point during dialysis session. This was a positive thing that 64% said very comfortable, 31% somewhat comfortable, 5% unsure. Again, we're trying to increase the comfort of those who are being checked and their access being used during dialysis sessions. We'd like to get these numbers higher. We asked, how effective do you believe proper hand hygiene, washing with soap and hand sanitizer, is in preventing infections during dialysis? And this is where you see patients and caregivers really kind of responding with what they know and what they've learned. 85% saying very effective, 15% say somewhat effective. No one is saying that it's ineffective. There's a very high general awareness that the basics of infection control are critical to preventing infections. We asked, how often do you see your or your loved one's healthcare providers and or care partners washing their hands or using hand sanitizer before touching the dialysis access or equipment? 71% always, and that's a fantastic thing. 19% sometimes, rarely 5%, never 5%. That 25 to 30% is what we're also focused on today, because we want to make certain that folks speak up if they don't see something appropriate happening related to their access. This is on the proactive side. We asked our surveyors, how actively do you remind your or your loved one's dialysis team about hand hygiene during dialysis sessions? This was interesting. Only about a quarter of the patients said they always remind them. 12% said sometimes. But 31% said no, they feel it's important, however, and 31% said they didn't feel the need to. Those who don't feel the need to might feel confident and trusting of their providers, which is fine. But for those who don't say something and don't speak up, but still feel it's important, we're encouraging those patients to have an active voice in their care and to make certain that they mention hand hygiene and remind the staff. And then we asked if folks observe the cleaning and disinfecting process at your or your loved one's dialysis center. Again, the majority, 63%, said yes always. 29%, about a third, said yes occasionally. 7% said no, never. In terms of schedule, you're not always in a position to see this, but we encourage folks to actively look for it and watch, and to make certain that the process is thorough and centered on them and their protection, so that they are in the best position possible to receive the treatment that they need safely. We asked how confident you are that the dialysis station is adequately disinfected to prevent infections. Again, 54%, the majority, say very confident. 41% said somewhat confident. 5% said not confident. That 41% is somewhat confident. We'll have to see what we can do to increase that. It may mean that patients have to proactively ask, hey, when was the last time this was cleaned and disinfected? Or did you just do this? That's proactive in your own care, and that's what we encourage. We also ask, from your perspective as a patient or a caregiver, how can dialysis centers improve their infection prevention practices? And top in the list here is provide greater choice and access to new innovations that protect you during your and after your treatment. Clearer communications about infection risks and prevention, about half. More frequent cleaning and disinfection of dialysis stations. Improve access care protocols, about a third. And then you can see hand hygiene and glove use. But right at the top here, it's interesting to us that communication about new innovations that are available to folks is critical, and that clear communications about infection risks and prevention are part of an ongoing dialogue. And just to make this point again, I want to come back to this, that when asked, those who were surveyed said that if a new medical innovation were available for dialysis patients who receive treatment through a central venous catheter, they help better protect their dialysis catheter access and help reduce the risk of catheter-related bloodstream infections. Would you want that choice? And patients and caregivers, 92% said yes. So as we conclude this survey information, let me just make this key point. Patients are aware of what puts them at risk for dialysis treatment. They're acutely aware of it because their life depends on the treatment. So empowering patients to know how to proactively raise questions with confidence, how to work with staff as a team, and just as importantly, how to ask for new innovations that have come into the marketplace that can protect their life and reduce the burdens of high cost sepsis infections and CRBSIs is very, very important to AAKP. We fight very hard to get innovations through the FDA regulatory process and then to have them paid for by CMS and other payers. But if patients don't have access to those innovations, what you end up with is a patchwork quilt of safety mechanisms across the United States. And that simply isn't, it's just simply not a good thing, and it's not fair to patients. Any patient who's receiving critical dialysis treatment should be safe, regardless of where they are, what state they're in, what neighborhood they're in. And we believe that standard should be held high. That's why we're so very pleased that the CDC and the Making Dialysis Safer Coalition is aggressive and forceful in their partnerships because they want to make certain that the patient is at the center of the care and that the ideal of a safe and good treatment session is met each time and every time, regardless of the facility. So with that background, I'll turn it back over to Jerome. Jerome, again, thank you for putting this together and the great appearance by our ambassador later on today and by the CDC. You've done great work here. Thank you.
Thank you, Paul. We really do appreciate you being with us today. And again, what we're hearing is clear. Patients see what's working, but they also see where confidence breaks down. They want stronger communication, greater transparency, and access to innovations that can better protect them. And that's exactly why our conversations like this today matter. Today, we're thrilled to feature the CDC's Making Dialysis Safer for Patients Coalition as part of this webinar. We have a great speaker who will highlight the coalition's impactful work. Stephanie Booth is the infection prevention educator for the Making Dialysis Safer for Patients Coalition at the Centers for Disease Control and Prevention, contracted through Chiniga Inc. She is certified in infection control, has a degree in public health, and is a former certified clinical hemodialysis technician. Her expertise relies heavily on her 15 plus years in the dialysis setting as a tech, biomed tech, water tech, clinical coordinator, educator, and assistant administrator. Stephanie, I turn the program over to you.
Well, thank you so much, Jerome, for that introduction. And it is an honor to be here today and to present. Thank you for having me. This is wonderful. And I really appreciated those opening remarks from the survey. I think they're going to play right into my slides very well, even though that wasn't planned. So today I have a few objectives listed here that I'm going to go over. By the end of the presentation, I'm hoping that you will be able to describe how the Making Dialysis Safer for Patients Coalition, or I'll refer to it as MDS, helps keep patients safe, explain how MDS works to prevent infections in dialysis care, identify helpful MDS resources and tools that you can use, and describe the benefits of participating in MDS and how to get involved. I thought we'd start with just the basics here. So what is the Making Dialysis Safer for Patients Coalition? Well, the MDS Coalition is a collaboration of diverse organizations and individuals who have joined forces with the common goal of promoting the use of CDC's recommended interventions and resources to prevent bloodstream infections, or BSIs, in dialysis patients. I've highlighted the word organizations here because I want to acknowledge that and thank AAKP for being such a great partner organization and having that relationship with us. The AAKP announced its formal partnership in 2016, like Jerome said, but that was nearly a decade ago. And we have worked on many projects together and shared information and products that help keep patients safe. And it's been a wonderful collaboration over the years, and we look forward to many more years ahead. I wanted to get into a little more specifics now and talk about the goals of the coalition. So the goals of the coalition are to implement and adopt core interventions, and we're going to talk about those in a couple of minutes on the next couple of slides, through use of audit tools, checklists, and other resources, and to spread the word about these core interventions and these resources, and to share skills and findings with other coalition participants. So coalition participants can be partners, organizations like AAKP, or members. And some examples of members include individuals that work in dialysis educators, patients and caregivers, you name it. Anyone could be a member of the coalition. And we currently have greater than 90 partners and 1,800 members. The coalition came out of the work of the CDC Dialysis Prevention BSI Collaborative, which is a little different than the coalition you may be familiar with today. But understanding the history of this is helpful as we move forward with this presentation. So I'm just going to go through a few slides and talk about that. So the BSI Collaborative project started in 2009, and it involved a small group of motivated dialysis centers who volunteered to work together with CDC to reduce infections, and it was funded by CDC. At its peak, there were about 40 dialysis facilities that were participating in the collaborative with various levels of involvement. And their goal was to demonstrate preventability of bloodstream infections through increased adherence to existing recommendations. At the time, it was not known if BSIs could be prevented in hemodialysis outpatients. So the collaborative members worked together for many months. They did it virtually and a couple of times in person to look at care practices in outpatient facilities, look at research, and look at data. At one of their in-person meetings in Boston, they were able to all bring together all of their knowledge and their expertise and what they had looked at, and they defined a bundle of 9 dialysis care practices that they believed could reduce bloodstream infections. So these were not new practices, and they were just based on regular recommendations, but putting them together as a bundle of things to do was different for this dialysis setting. So here you can see what we now know as the 9 core interventions. It was this bundle that these facilities wanted to implement. So the first was conducting surveillance for bloodstream infections using the National Healthcare Safety Network, or NHSN platform. Another was to perform monthly observations of hand hygiene and share those results with the clinical staff. Another was to perform observations of vascular access care and again, share those results with the clinical staff. To train staff on infection control topics when they're hired, and then every 6 to 12 months, provide education to patients on infection prevention topics such as vascular access care, hand hygiene, and risks of catheter use, just to name a few. Incorporating efforts to reduce catheters, the use of alcohol-based chlorhexidine as an antiseptic for central line insertion and during dressing changes, scrubbing the hub of the catheters with an appropriate antiseptic, and last was applying appropriate ointment or to the catheter exit site during dressing changes, or using a chlorhexidine impregnated sponge during that dressing change. So after these 9 core interventions were established, these same facilities participating in the collaborative worked to put these interventions in place. And they tracked their data, and they also continued to meet regularly to network and share their experiences. So here's some of the data demonstrating the success of the collaborative project. So I'm not going to go through it in detail, but the graph on this slide shows some trends in access-related BSIs over time in those facilities that participated in the collaborative. So on the x-axis, you can see the month and year, and on the y, you can see the rate of BSIs. So the blue downward arrow pointing at January 2010 indicates the approximate time that those interventions were implemented at these facilities. If you focus on the solid black line, which represents the modeled rates across the facilities, you can see that it's actually a very nice flat line leading up to the start of the project. And then there's this 54% reduction in BSI rates right around the time of those interventions when they were implemented. And because attention to infection prevention measures can wane over time, the CDC actually conducted a follow-up study in 2016 to assess if these were sustainable. So were the facilities still maintaining that 54% decrease in bloodstream infections for their patients? And what it showed was that these rates, yes, were definitely sustained over time for 4 years or 48 months as they looked at it. And also, just on a side note, we're also currently looking at a 15-year period of this data to see if it shows a similar trend. And just initial looking at the data, nothing has been produced or published yet, but just that initial look actually shows that it is very similar. So now I've given you some background on that collaborative, but now let's look at how it became the Making Dialysis Safer for Patients Coalition. So as a reminder, it was started in 2009 and was that small group of facilities working together to identify and implement the best practices for bloodstream infection prevention. And then in late 2015, Amgen Inc., a biotechnology company, provided funding to the CDC Foundation to support the Making Dialysis Safer for Patients Coalition. So this funding provided the impetus for the creation of the coalition, and it was a 3-year project intended to build upon the success of the collaborative, which we've talked about in detail. So utilizing partnerships with a broad range of stakeholders in the dialysis and infection prevention communities, the coalition allowed for nationwide expansion for implementing those best practices, those 9 core interventions in all hemodialysis facilities. Additionally, patients and their representatives were able to have a more central role in the coalition effort. And we will highlight some of these as I go through the slides today. So let's move on and look at some of the resources that have been shared through the coalition and talk about what it offers to partners and members. So the coalition offers a variety of materials that are targeted at assisting clinical staff and dialysis patients and their families in preventing infections. They include newsletters, patient education tools, networking and sharing opportunities, posters, videos, and many, many more. I will be highlighting a few of them. So first, I wanted to highlight the newsletters. Shown here are some examples of coalition newsletters. These communications aim to increase engagement and networking among our members and our partners. And they feature coalition activities, partner success stories, meeting summaries, and other activities that highlight the infection prevention work happening within dialysis organizations and in the dialysis community. The Days Since Infection poster was created in partnership with the American Society of Nephrology, or ASN, and it's available in both English and Spanish. We translated it into Spanish at the encouragement of our partners, and this is an example of a tool that the coalition worked directly with a partner to create and disseminate. The Days Since Infection poster is a great way to raise awareness about BSIs, and this poster encourages centers to display the number of days that have passed since the last bloodstream infection at their facility. And so here we actually have 2 pictures of some social media posts, and you can see these 2 facilities are celebrating 100 days without a BSI. We have a number of other posters as well that have been created over the years. This slide shows just a few of those. In the center, you can see a conversation starter. And this tool was actually created by a patient engagement work group that was developed at our 2017 in-person meeting, and then with support from AAKP to assist patients, family members, and staff to have meaningful conversations about preventing infections between staff and patients and their families at their own facility. There's also a best practices for dialysis staff video that contains 5 segments with best practices on how to prevent infections in patients with catheters, fistulas, or grafts. And this video is intended to be used by outpatient hemodialysis facilities as an educational tool for frontline staff, including technicians and nurses, about those infection prevention measures, but we encourage everyone to watch it, including patients, to learn proper infection prevention steps. It also has an accompanying pocket card for patients that conveys best practices for preventing bloodstream infections. There's also a continuing education course. It's a self-guided course that provides infection prevention training. Again, this course is intended for frontline staff, but we encourage all who are interested to take a look and consider learning more about infection prevention, including patients and caregivers. The coalition also has webinars to highlight infection prevention topics that are useful to dialysis staff, leadership, patients, and caregivers. Some examples can be seen on the right side of the slide, but I really wanted to let you know that we're planning 2 new webinars in partnership with the Association for State and Territorial Health Officials, or ASTO. And I have the save the date here and would love for all of you to attend. The first one will be on May 20th. And it will focus on building resilient dialysis systems and teams. And the second one will be on July 9th and will focus on sepsis recognition, risk, and response. Registration for both of these events is forthcoming and will be emailed out to our listserv and shared broadly among the dialysis community. The coalition also builds on work that comes out of CDC or other partner groups. For example, there was an American Society of Nephrology, or ASN, and CDC collaboration, which resulted in a white paper. This paper highlighted the importance of optimizing antibiotic use among those receiving hemodialysis and improving infection and control rates. Because of the white paper and what we heard from partners and members of the coalition, we used it as a building block. We then hosted a webinar, and then we heard from feedback from our partners and members that they actually wanted more information, so we created a web page as well. Now, this web page will be sunsetted soon, but the information will still be made available via a downloadable PDF. So some of our newer resources can be seen here. This resource is actually 3 products on the topic of hand hygiene when you're outside of the dialysis facility. It's meant for patients and caregivers, and there's also a staff resource as well. From left to right, you can see the infographic that can be displayed in a facility, a trifold brochure for the patients, and a staff conversation guide that can be used by the staff to actually talk about this topic with patients, caregivers, and whoever else. These were created with the input of staff and patients in 2024 and can be printed from our website. Soon to be released is a similar set of resources focused on how to care for your access when you're away from the dialysis facility. And I want to wrap up this section by talking about a specific patient-centered educational resource. It's a video with an accompanying handout, which is a visual reminder for staff about the importance of encouraging patients and caregivers to ask questions and speak up if they have concerns about their dialysis treatment. I would like to watch this video together, and then when it's done playing, I'll come back and we'll talk about some key takeaways. As a dialysis clinician, I'm committed to improving patient safety and preventing bloodstream infections in patients on dialysis.
Do you mind changing your gloves? I get very nervous about infection.
Infections are serious and sometimes life-changing events. You know what? You're right. Thank you for pointing that out to me. I'm gonna go change my gloves and I will clean my hands and I'll be right back. Patients and staff each play a role in preventing infections.
There's some blood there.
The first step is recognizing that we are part of a big team, and the patients are included.
It starts with, hello, how are you doing?
I always start out being nice.
It takes a lot of courage for a patient to speak up.
Patients are more inclined to speak up and engage if they see that a staff is doing the same.
You have to speak up in a polite way, but still, you need to let them know. I've had very good nurses and doctors along the way who've taught me that you need to speak up if something's not right or you don't feel comfortable.
There's a genuine interaction, that's where it starts. And as patients and their caregivers and the staff at dialysis centers are doing that, it becomes kind of an influence throughout the environment.
You need to voice your opinion, and your opinion is very important.
Maybe 10 years ago, I was a little bit reluctant to speak up, but through a lot of education, advocacy, experience, and seeing different circumstances, I now have no problem speaking up.
It starts with the staff. They should be encouraging all patients to speak up for themselves because you are your best advocate. And once you learn that, it's something you need to embrace.
In order to, help prevent infection, we all have to speak up. And I think the key is just to be kind as you're speaking to the staff.
Mother always told me you get more with honey than vinegar.
Changing the culture to involve patients and reduce infections seems like a really hard thing to do. I suggest you start with some small things. Encourage conversation, involve the patients, and teach them why it's important to prevent infections.
When I come in, I'll wash my access, get everything set down, I'll even do another round of sanitizer, and I'll say to the tech, okay, are we ready to get started? And if they continue on and I see that maybe they haven't washed their hands or something, I'll say, do you mind changing your gloves? I see you touch some equipment and I get nervous about infection. And then when people see that, they start to respect where you're coming from with regard to being compliant and using the proper techniques when putting me on the machine.
It's about taking care of yourself first, making sure you take care of your arm, your area, and making sure your area is clean.
Even though you're on dialysis, it doesn't have to be your life. It saves your life, but it doesn't have to become your whole life. And living your best life on dialysis means a couple of things. That, you know, being compliant, right? Following your regimen, not missing any treatments, but then also being very aware of your surroundings. And it's not just what you do, it's what other people do. It's just being mindful of the little things.
My advice would be to learn as much as you can about whichever modality you choose, whether it be PD or in-center or home hemo. Learn as much as you can, be your own advocate. Don't be afraid to challenge your nurses, your doctors, whoever, because it's in your best interest.
If you are a patient or a caregiver, although it may be uncomfortable at first, try to speak up and ask staff some general questions about your care and what steps they are taking to keep you safe from an infection. You can find resources and learn more about CDC's work to reduce infections. Visit cdc.gov/dialysis.
The first key takeaway I want you to consider from that video is the signs of infection. Do you as a patient know to look for those signs of infection? It looked like from the survey you do, but do you as a staff member talk about the signs of infection or other concerns openly with your patients and their caregivers? The second is that everyone has a role to play in preventing infections and improving dialysis patient safety. Infections can be serious and life-threatening, and many will experience anxiety, fear, and uncertainty related to their dialysis treatments and preventing infections. So share this video with others to give them some encouragement. And last, and probably the most important, is that your opinion matters. If you see something that's not right, or it makes you uncomfortable, say something. Like in the video when the patients pointed out that someone did not wash their hands or that the chair wasn't clean. These are just examples, and no topic should be out of bounds. So I wanted to end the presentation, it'll be fast, I promise, but to talk about where are we now? So I want to acknowledge that the success of lowering BSIs in outpatient facilities across the US is a result of collaboration of several groups, including public health organizations, professional societies like AAKP, dialysis organizations, researchers, clinicians, frontline staff, and patients. Outpatient dialysis facilities have made tremendous progress in preventing BSIs nationally. The graph you see on this screen shows bloodstream infection rates by access type. Blue is fistulas, red is grafts, and teal is for central venous catheters between 2014 and 2019. And the good news is that the pooled BSI standard infection rate, or the SIR, decreased by 40%. So we've made significant progress in preventing BSIs. However, BSIs still occur, so there's more work to be done. And right now, the coalition is focusing on increasing collaborations, reaching more frontline staff, and exploring the need for other resources, such as those for dialysis outside of the typical outpatient setting. And how can you help us in this effort and stay safe? Well, the first thing is stay involved. Work with your care team to keep you and all other patients on dialysis safe. Second, start a conversation. Use one of the tools we talked about today as a jumping off point, or simply ask your care team how they work to prevent infections. Speak up if you have concerns about your care. We know this is not always easy, but it is one of the best ways to open communications and stay safe. And finally, consider becoming a member of the coalition. Just go to our webpage, scroll down, and fill in the information, and you'll be added to our email list and receive a welcome packet after a few days, so you get all of our communications about new resources, tools, webinars, and other announcements. So I just wanted to thank AAKP again for inviting me to speak today, and I wanted you to have one last resource. So here is the coalition email where you can email me if you have any questions about my presentation. Thank you, and I'll hand it back over to you, Jerome.
Stephanie, thank you for that great presentation. Really appreciate it. We want you to stand by because we have a few questions we'd like to ask you after our next speaker. Next, please join me in welcoming Pesh Patel, an inspiring AAKP ambassador. Pesh is the founder and CEO of A Kidney Life. He is a former hospitality executive with over 3 decades of hospitality and real estate experience. He was diagnosed with end-stage kidney disease in 2017 and received a kidney transplant on August 7th, 2018, after 15 months on dialysis. Unfortunately, the transplant rejected 3 years later. Pesh is now treated with hemodialysis, receiving treatment through a central venous catheter as he awaits his next transplants. Please welcome Pesh to the program.
Thank you, Jerome.
So, first question for you. Can you share a bit about your kidney disease journey, when you were first diagnosed and how that experience unfolded?
Sure. As you mentioned, former hospitality executive. So I was working on a project in Australia, and this was 2017, as you mentioned. And I'm in Melbourne, and I woke up one morning feeling the worst I'd ever felt. So I go into the ER, and within 2 hours, I had 2 blood transfusions, and I'm taken to ICU. Found out that only one kidney developed since birth, and that one kidney was only 2% functional. So I was on a CRRT machine, a 24-hour dialyzer initially, and then they put in the CVC here, and I was on hemodialysis, as you mentioned, for 15 months until my first transplant. Then life was great again. I was traveling again, and things were back to normal, so to speak. And unfortunately, 2.5 years later, the kidney rejected. And so even through all the therapies and everything we tried, that kidney was no longer viable. So as of August 2024, I'm back on the transplant dialysis, and I'm back on the transplant wait list.
Now, as a current dialysis patient, you receive treatments through a central venous catheter. Can you tell us more about why you chose this type of access?
Sure. I have seen, even through the first time, I told my medical team that the next procedure they would do on me is the transplant. And I said the same thing this time. And the reason is I've seen the horror stories with fistulas, and, I just thought that, worst case scenario, I didn't want my arm looking like a Cleveland Browns helmet. And, if it didn't work on one arm, they'd go to the next arm. If that doesn't work, they'd go to the leg. So it was just the worst case scenarios popped in my head. And I knew that if I were able to properly take care of my CVC, then I would be okay.
As we had discussed earlier today, individuals on dialysis, particularly people on hemodialysis, face an increased risk of infection at their access site. And that risk is even higher for those using a central venous catheter. You were aware of this and advocated for access to an FDA-approved innovation proven to significantly reduce infection risk. What did gaining access to that product mean to you?
Yeah, I was fortunate enough where I was at ASN Kidney Week when I was in San Diego a couple of years ago, and I was introduced to the product, DefenCath. And so I started learning about it, and I realized that immediately I wanted it. It was something to add a level of security, if you will, for me, and safety. And also the other methodology I cannot use because I'm allergic to chlorhexidine. So DefenCath was the best method for me. And in addition, it wouldn't just be at the end of the catheter, right? This would actually be inside the catheter, and it's proven to help prevent infections up to, over 70% safe. So after researching, I was the squeaky wheel, if you will, to get it into my dialysis clinic, which I'm at a Fresenius. And so Fresenius didn't carry it at the time, but after 10 months of fighting, if you will, back and forth, communications and doing everything I could to be as loud as I could to make sure Fresenius offered not just for myself, but for other patients. Finally got it right before Labor Day, I believe, of 2025. So it was well worth it. And as soon as I got it, it's just a sense of relief.
Good for you. Good for you. Beyond caring for your access site, what are some steps you take both inside and outside the dialysis facility, to help you protect yourself from infection?
Sure. I can think of two things. And one is when I feel like the Tegaderm or the cloth cover is coming a little loose, what I'll do is put on a mask, put on the gloves, and I'll use a solution called Accept. Again, I'm allergic to chlorhexidine, so can't use that. So I use this product called Accept and clean the area with that. Then I'll apply a new gauze and tape, and then I'm good to go. Another thing is, of course, shower shields. When I shower, order them from Amazon. And I know other patients also use saran wrap as a way to make sure that the area does not get wet. So those are two things outside the center. And inside the center, I always ensure that the staff has a mask on and gloves on whenever they're around my chair as an added layer of protection.
What do you look for from your dialysis care team to feel confident that your treatment is being delivered safely? I know you mentioned they are wearing gloves and masks. Is there anything else?
Yeah, I don't just look at myself when I'm in the dialysis center. I also see that they're being attentive to others, and I see how they're working. I also make sure that there's communication. I always make sure there's communication because, there's a lot of times when there's not trust between a patient and the medical team or the medical arena itself. And one way to grow that is through communication. So I'm always speaking. Anytime somebody comes by my station, if they're at the machine, I ask them what they're doing. I'll ask questions like, how much time do I have? What's my blood flow rate? What's my latest BP reading? Things of that nature.
And final question for you. AAKP has our Every Patient Safe campaign going year round. What does Every Patient Safe mean to you?
Sure. To me, Every Patient Safe means that safety is a shared responsibility between the care team and the patients themselves. I think it's having a dedicated team that prioritizes each patient's well-being inside the dialysis clinic, while also recognizing that we as patients must be proactive, hold ourselves accountable, and be informed about our own care, both during our treatment and in our daily lives. Ultimately, it's important for patients to feel empowered to speak up, to ask questions, and to advocate for ourselves, knowing that our voices are essential to creating a safe and supportive environment.
Thank you, Pesh. Your valuable insights about patient safety. We really appreciate you bringing that point of view to the program today. I'd now like to bring Stephanie Booth from the CDC back to the program to answer a few questions we received from our audience members as they registered for today's program. So we have Stephanie and Pesh that will be answering a few questions. Stephanie, the first question for you. From your perspective, what is the most overlooked risk when it comes to infection prevention in dialysis settings?
I think that I'm going to say rushing, but let me explain what I mean by that. As a former technician myself, I understand that staff are busy. They're running around, they're doing lots of things. This oftentimes can lead them to seek out ways to be more efficient and to perform shortcuts, or even to simply forget steps in a very important infection prevention procedure. And this busyness is also seen by those in the chairs. They're the patients who think, I don't want to bother them right now, or they work so hard, I don't want to add stress to their day by telling them about whatever it may be. So I think that slowing down, taking the time to do things correctly, and pointing out when there's a concern, even when somebody looks busy, is probably the best way to reduce risk, in my opinion.
Thank you, Stephanie. Next question is for Pesh. What makes you feel safe or unsafe during dialysis treatment?
When I see staff not paying attention, when I see that they are going through motions without doing things properly. They're rushing, as she just mentioned, and not taking the proper time to speak to the patients. And again, back to communication and just doing things to do them. That's when I start feeling a little uneasy.
Thank you, Pesh. This next question is for Stephanie. We heard in the survey that many patients don't always feel comfortable reminding staff about hand hygiene, even when they know it's important. How do we change that dynamic?
Well, I think the video I shared addressed this somewhat, but we need to be sure that those lines of communication are open and honest between staff and patients. Patients should always feel safe enough to voice their concerns, and sometimes this means that the staff need to be more receptive to having those honest conversations. And I'm not sure I have the perfect answer on how to change that dynamic, because it may take some time. But I think the easy first step is for, to share that video and the tip sheet with others. It may encourage other patients to speak up, and maybe staff need to hear, see, and read how to respond appropriately when those open and honest conversations are happening.
Thank you. This last question is for the both of you, but we'll start with Stephanie. If you could change one thing tomorrow to make dialysis safer for patients, what would it be?
I think this one is a little bit hard because it's hard to narrow it down to just one for me. However, I think it would have to be having everyone understand that dialysis infection prevention is really a team event. Patients, nephrologists, frontline staff, even water techs and receptionists in the facility, or if you think bigger, like health departments, networks, or even the CDC, all have a role in keeping patients on dialysis safe. And everyone has a place on the team, whether it's on the bench or in the lineup. And it doesn't really matter because we need to work together as a team to accomplish the end goal of keeping everyone safe.
Thank you, Stephanie. Pesh, same question to you. If you could change one thing tomorrow to make dialysis safer for patients, what would it be?
It goes back, I think, to something I like to say, which is awareness leads to education, education leads to empowerment. So there's patients that while they have their CVC and waiting for a fistula or the fistula to mature, they're not aware of the risks. And also, like the video that was shown earlier, I don't think that all patients are aware, or even some dialysis staff is not aware of what can happen and the risk of hospitalization or sepsis and things of that nature that ultimately leads to death. So I think education and awareness of infection is huge.
Thank you both. I want to extend a heartfelt thank you to both Stephanie Booth and Pesh Patel for being a part of today's program. If anyone watching has additional questions for our speakers or about today's webinar that we were unable to get to, please email us at info@aakp.org, noting the webinar title in the email subject line. If you are not already a member of AAKP, we encourage you to join. AAKP offers free membership to patients and their family members, as well as living kidney donors. To become a free member, join online at aakp.org/join or by phone at 1-800-749-2257. To receive all the benefits of membership, please be sure to include your email address when signing up. As an AAKP member, you will be notified about all of AAKP's upcoming events, the latest in our educational program series, and when opportunities arise where your opinions and experiences are needed to help inform innovation, advance care, and make a meaningful impact to improve lives. We encourage you to respond to our flash surveys and other engagement opportunities to help us elevate the independent patient voice and change status quo kidney care. You will also receive a digital subscription to our bi-monthly magazine, AAKP Renal Life, and can select to receive any of our 5 different electronic newsletters, all for just signing up. We also invite you to check out our blog to read some great articles and patient profile stories, and follow us on social media for all the latest news and to keep up on what's trending. AAKP is dedicated to helping kidney patients across the disease spectrum understand their condition and take control of their health care. We are proud to offer a variety of resources for both patients and care partners. By visiting our website at aakp.org and clicking on the AAKP Store button at the top of the homepage, you can find a variety of educational brochures and online tools to order or download free of charge, including titles such as Conversation Starter, Questions to Ask Your Healthcare Team About Choosing the Right Therapy for You brochure, or Coping, Living, and Thriving with Kidney Disease. You can also order materials by phone. Registration is now open for the 8th Annual Global Summit on Kidney Disease Innovations. Join AAKP in partnership with George Washington University School of Medicine and Health Sciences for the global virtual event on May 18th and 19th. The Global Summit brings together patient advocates, researchers, clinicians, and innovators from around the world. Virtual participation is free for all. Visit the AAKP website to register today and reserve your spot. We are excited to announce the date of the AAKP Public Policy Summit. The 8th Annual AAKP Public Policy Summit will be held on July 23rd at the National Press Club in Washington, D.C. Registration for this free event is now open, and a virtual option is also available for those unable to join us in person. Please continue to visit our website and follow us on our social media channels to be kept up to date on the latest event information. Be sure to save the dates for the AAKP 2026 Awareness Days. May 1st, we recognize National High Potassium Awareness Day, raising awareness about potassium balance, symptom recognition, and the importance of timely lab monitoring and treatment adjustments. And on June 3rd, we recognize National Itch Day, highlighting a symptom that is often overlooked but can have a significant impact on quality of life for people living with kidney disease. In addition to these awareness days, and as I mentioned earlier, AAKP supports patients year-round through our Every Patient Safe campaign, which provides education and tools focused on emergency preparedness, infection prevention, and patient safety. To learn more about these awareness efforts and access resources, visit the AAKP website. Finally, you can visit our special AAKP On Demand webpage at bit.ly/AAKP On Demand to watch a number of great presentations and webinars, all available on demand from our 2025 events and programs, as well as 2026 programs as they occur. You can also visit the AAKP YouTube channel at bit.ly/AAKP AAKP YouTube for more great content. We would like to extend a heartfelt thank you to our webinar speakers, Stephanie Booth, Paul Conway, and Pesh Patel, for graciously participating in today's HealthLine event. Their expertise and insights greatly enriched the discussion and provided valuable information. And thank you to everyone who joined us.